piece of equipment. So we just pass it 1, 2. Good afternoon. So, first of all, I'd just like to ask, are you sitting comfortably? Okay, excellent. And is your arm in a comfortable position before I commence the examination? Excellent. So, a quick summary of the examination today. We are going to start off with some measurements that we will record, that will get added to your medical information we have on file. Then I will carry out some, you can call it TLC, tidy up your nails, really focus on the presentation. Then after that I will use these tools to relax the muscles, relieve any pressures, and relax the tendons. It's quite common for tendons to get highly stressed from overuse and highly strained. And then after that we'll finish with some just a bit of polish on your nails, and that will essentially be the examination complete, so it shouldn't take any longer than 20 minutes. So if you are comfortable and you are ready, if we can start the examination, that will be fantastic. Okay, so I've got your files here. This is your information we had from your last visit, which was April 2022, a few years ago now. So we'll just start off by checking the measurements of the thumb, the index finger, middle finger, ring finger, and the pinky finger. But before I begin that, I'd just like to have a brief look and just a little check, see if we can detect any swelling or any lesions on the skin. So it doesn't look like there's anything to be too concerned about. Okay, now I'm just going to gently press up your forearm. Just tell me if you feel any pain at all. Okay. Do you notice any sort of discomfort or any pain or swelling in any of your knuckles or your wrist? No? Okay, excellent, excellent. There doesn't seem to be anything anything noticeable there, so that's fine. I'll just take the measurements and we can record them on the file, and of course that will get added to your medical records. 2026 January. So we'll start off with the pinky finger. So we'll go from, just rest your arm for me there, thank you. The knuckle. So that's 71 millimeters for the pinky finger. So 4 years ago, your pinky finger was 70 millimeters. So anything within 1 or 2 millimeters, we simply classify that as potential for human error. So we can't draw any conclusions from a change in measurement 1 or 2 millimeters. There's simply no way to rule out that it's just human error. So that's fine. Now if we have a look at the ring finger, just get a measure here. So we have 95 millimeters. 95 millimeters. So your last reading was 84 millimeters. So of course that is an increase of 11 millimeters. But I believe you told me in the initial discussions that you had been playing piano extensively for the past 3 years. So there is a potential that you've undergone some finger growth and development due to using your fingers a lot more. If we now measure the middle finger, that is 99 millimeters. Your last reading was 97 millimeters, or again within 2 millimeters. We can't draw any conclusions from that. Now, if we go to the index finger, index finger is 89 millimeters. So 4 years ago it was 90 millimeters, now it's 89. 1 millimeter of difference. It's within the tolerance, so we simply discount anything from that. Now if we measure the thumb, the thumb is 65 millimeters. Last medical exam, the thumb was 67, so it's within 2 millimeter range. So the only finger with any substantial change is the ring finger, which has undergone over 10 millimeters of change in length. Now, seeing as you're not having any pain, there's no swelling, we're not going to refer you for an x-ray. We normally would if there was any change over 10mm, but seeing as we know you've been playing piano extensively and there's nothing of concern with the nerve examination or anything like that, I don't think we need to refer you. So, one final test, if you could just, when I tap your finger, if you could just lift it up like this and drop it down, that would be great. Excellent, thank you. So I'll have these files added to your medical report and we can get them put away. So the next step, what I'm going to do is just so now what I'm going to do is gently massage the lower forearm and the hand and the fingers with these Massage Pro Invitalize vials. These are the Lux and Willow special edition. So this is simply going to relax the muscle, ease any stress or aches or strains within the muscle, joints and ligaments. Okay. thank you for that. That is now complete. So next, I'm just going to possibly tidy up some of the nails and adjust any cuticles if necessary. On initial inspection, it doesn't look like there is any extensive work that needs doing, so it should be relatively quick. Let's see. So is this the correct? Yes, so this is the correct one. I need the cuticle adjuster. I think I might need one of these as well. Just close that. Okay. So I'm just going to adjust cuticles. Okay. Nearly there. Excellent. So there is just a bit that I want to. So now I will clean out the underside of the nails. Okay. Excellent. We can put these away. Oh, I think I put that in the wrong one. Okay, so next I want to just give the nails a very, very quick and light trim. And to do that, we'll be using these Brookstone nail clippers. They really are some of the best. Stainless steel. However, I haven't actually used these before, and therefore they haven't been sterilised. So I do have this with me. This is a just in case you were wondering, it's a medical tool sterilisation piece of equipment. So essentially, any tool that's going to be used on briefly pass it through the flame. Briefly pass it through the flame, and that will essentially sterilise it. And then any bacteria or anything contained within the packaging will be terminated, and it will be perfectly clean to use on our patients. So if I just pull this out, if I can get it. So as you can see here, Brookstone like to make sure that they are very tightly wedged in there. So these are the nail clippers that we'll be using. These are, I think they are called the Brookstone Essentials. A very effective and well sought after piece of equipment in the nail tech industry. So now, as this is procedure, we will sterilise the piece of equipment. So we just pass it 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And now we can be sure and comfortable that this is completely sterilised. For use on our patients. Okay, so now I'm just going to perform some trimming exercises. Let me just check if I have my file on it. Not to worry. Okay. Okay, and lastly, if I can just check the thumb. Okay. So now ready for the next patient. I'll just give this a quick sterilise. It will also undergo a wash, but I call it personal preference. I like to sterilise my equipment after each and every use, or at least my equipment that performs any kind of, cutting or this type of thing. Measuring devices and the like. I don't tend to bother with anything like that. Okay. So So far, we have checked for swelling or any lumps. We have taken measurements that will be added to your file. We have adjusted the cuticles on the fingernails, and we have trimmed the fingernails themselves, and we have released tension in the muscles, joints and tendons with the massage glass vials. So that brings us to the final stage of the examination, which call it complimentary extra, if you will. Since we adjusted the cuticles and trimmed the nails, all we'll do now is just polish up the nails, which most of our clients tend to like. It's just a little extra that we like to do that just gives you that bit of shine on your nails, makes you feel a bit better. So I'm just going to get cotton. In case you were wondering, because I know you mentioned it at the beginning, these are indeed 100% pure cotton. Okay. The brand here, Lucura, we've used them for many years, and rest assured, their products are the best quality. So nothing to worry about there. So we'll just take one. Okay, so let's open this up. Just check this is the right one. EXP 1052024. This is the 03. That's right. Yep, that should be right. So we'll just apply some of the nail polish to this cotton pad. Okay. And now we can professionally apply some excellent quality nail polish to your freshly adjusted nails. And a bit more just for the thumb there. Fantastic. Marvellous. So, thank you for coming in today. Obviously, I've got your information here, which we will update your medical records with. If you would like to book in the same service for